Good afternoon, everyone. My name is Margo Mountjoy, and I'm a sport and exercise medicine physician from Canada. I'm afraid my accent isn't quite as jolly as Graham's accent. You'll have to put up with my Canadian English. So I'm switching approach from nutrition after lunch to mental health. And I want to talk about mentally fit golf. And in introduction, I want to show a few faces to bring the topic to reality of some of the very brave, in this case women, who have come forward with their mental health issues. You probably recognize some faces here. Naomi Osaka from the French Open last year, Simone Biles from the Tokyo 2020 Olympic Games, and others here. The suicide of the triathlete from Korea from harassment and abuse and depression subsequent. So this is a very real problem. How many people here are clinicians that work with athletes or coaches, somebody who works directly with athletes? Okay, most of us here. So this is going to be a very practical session for you on how to recognize and what to do about your athlete mental health, both from a prevention perspective as well as an intervention perspective. But let's not forget that golfers as well have also come forward with their mental health symptoms and challenges that they've faced as professional athletes. So let's back up a little bit and talk about the mental health benefits of sport in particular, not golf, but in sport, we know that there's a positive effect of exercise on symptoms of anxiety, stress, and depression. This is well defined in the literature. But when we look at the prevalence of mental health disorders in athletes, we find that it's about the same as the general population, with the caveat that eating disorders is higher in athletes than in the general population in certain sports. So in fact, we don't really see a protective effect in our elite athlete population from sport. So let's look at the mental health benefits of golf. Well, this is quite an old study, 2004, and this was a study that took quite severe chronic patients with mental health problems and introduced them to golf to mostly improve their physical activity and their social inclusivity. And on qualitative analysis, they did report a positive impact on their mental health. So this is quite an old study, and actually one of the few that have been published on mental health in golf. A scoping review by someone well known to all of us, Andrew Murray, showed that there was no consistent evidence for the association of effects of golf on the mental illness reported. There was a few studies showing improvement in anxiety and a few studies showing increase in anxiety in this population. However, there was positive impacts on mental wellness as being defined by self-efficacy, self-worth, self-esteem, etc. So we have some nice evidence on mental wellness and mental symptoms, but not actually mental health disorders. Now, this is a study in publication, so please do not tweet, do not forward this, because this is unpublished data that's in the publication process. And this is from the 2020 Challenge Tour, a cross-sectional cohort design, survey design, about a 24% response rate during a 2-week period off-season, so during training, not during tournament time. And the results showed that 82.8%, so 83% of the athletes that responded to this survey had at least one mental health symptom, and almost a quarter of them had more than one. And you can see quite high in sleep disturbance and compulsive behavior. Probably not a surprise to any of us here that work with athletes that compulsive behaviors and sleep would be leading the list. Quite a high number, but maybe there is in this report self-selection with people with symptoms more likely to respond to the survey. I don't know, but it looks pretty concerning from my perspective. Also more concerning that only 22.4% actually recognize themselves as having a mental health problem. So they may have symptoms, but not recognize that they have actually a disorder or problem. And of those, only a third sought help. So if you've got 83% having mental health difficulties, but only a third accessing help, that's a huge red flag to me. Why are those in need of help not seeking help? So in summary of the science, we see that participation and spectating improves physical activity, which we know improves health. We know that golf participation improves mental well-being, but we just need more information on the effect of golf on mental illness or preventing mental health problems. So let's make sure we're talking about the same things here. The definition of mental health symptoms are negative patterns of thinking, emotion, or behaviors that can interfere with life function. Whereas on the other end of the spectrum, a disorder is a clinically diagnosed mental health problem that's persistent, that changes an individual's thinking, their emotions, or behaviors, that has significant disruption in their day-to-day life, training, or competition. So you can see that it's actually a continuum between mental health symptoms and mental health disorders. Now, important to recognize that you can have an athlete with a clinically diagnosed mental health disorder who's actually in an optimal health and peak performance with the appropriate supports and mental health supports. So please note that having a mental health disorder does not preclude one from being an optimal athlete. Very important caveat. So what is unique about sport with respect to mental health over and above the general population? And I think we can put them into three buckets. One, can't imagine what the mental stress was on those athletes in St. Andrews 2 days ago. There's stresses involved in competition. They also bring with them their own personal stressors from their day-to-day life in their relationships and workplace. And then there's organizational stressors that are related to travel, sport organizations, leaderships, performance. Maybe there's harassment and abuse issues in their sport culture. So there's a lot on their plate, and for many athletes, sometimes they feel it's just too much to juggle and they're not strong enough to handle all of the things on their plate. And let's add to their plate COVID-19. We've postponed events. We've had an inability for a lot of athletes to train during this time period, economic, social impacts, and decreased access to care. So all of these things has documented worsening of athlete mental health during the COVID-19 pandemic. So I'd like to now offer, having painted a rather gloomy picture here, I'd like to offer some solutions and ideas for all of us here. And there exists the IOC consensus on mental health, which is 2 editions of the 2019 BJSM. And the idea of this was to provide guidance for clinicians on how to recognize and treat and prevent mental health problems. We talk about prevalence of mental health symptoms in elite athletes. We talk about a clinical approach to how to manage these problems. And then what in the sport environment may influence an athlete's mental health, such as injury, performance failures. I'd like to be in the head of a certain North Irish golfer today, 2 days after St. Andrews, to wonder what thoughts are going through his mind. There may be harassment and abuse issues within the sport culture, and a very significant one for mental health is the transition out of sport. We also discuss mental health emergencies. Do we as clinicians who work on the field of play at tournaments and in training know how to manage a mental health emergency? What is your action plan? And we address also Paralympic athletes as well as future directions. So here's some of the findings in that paper. Anxiety around 34% of all elite athletes. Depression a little bit lower, higher in females than male. Sleep around 50%, so that was consistent with the golf data I showed you. The alcohol misuse is an important one, higher in male sport and higher in team sports. Eating disorders, higher in females than males and higher in the aesthetic sports. We have a nice paper from athletics, suicidal ideation, wow, up to 17% in that population, Swedish athletics. And important to remember that in eating disorders, it has a 10% mortality rate from suicide. So please take the mental health seriously of your athletes. We don't have good data on PTSD, bipolar, a little bit on gambling. ADHD, our data comes from anti-doping really more than anything. So what are some of the barriers to our athletes seeking help that I mentioned they're not? And I think all of us could probably agree that stigma is still a big problem in society in general, not to mention even compounded more in sport. It may be a lack of time, a lack of money, a lack of access to care. There's many, I've listed them all here. There's lots of barriers for seeking help. But at the same time, there are lots of facilitators of things that we can do in our sport organizations, in our realm, to improve access to care and facilitate. Really normalizing the culture to talk about mental health is the first step. Being open to recognizing someone in trouble, talking about it, and making sure that we all have our pathways to more expert care should someone need it. There are resources available that we can all use free of charge, and the IOC's developed an Athlete 365 Mentally Fit campaign. So that group of individuals I showed you that were involved in the consensus paper, a subgroup of us are working on an IOC mental health task force on knowledge translation. So here's some of the things that we have come up with that are free for everyone to adopt off the IOC website with your golfers. And one is the Athlete 365 web pages. And it's called the Mentally Fit campaign, and the athletes just register free of charge, and they can see the little caveats and snippets of mental health and mentally fit information that we feed in there on a regular basis and keep changing it. And this campaign has articles, interviews, media content, and through this, it actually opens up the conversation for athletes to talk about their mental health. We also have a presence at the International Athletes Forum. We have a mentally fit awareness program through the Athlete 365. And around the Olympic Games, for 6 months post-Games, we have a well-being support line that Olympians can access free mental health support just by dialing a number, free of charge. There's a webinar on keeping mentally fit during lockdown, which is out of date now, but was available during the lockdown. And having lots of athletes talk about their experience, so our stars, Olympians, talking about their mental health. So that's a great tool for athletes and for coaches. But what about for us and for sport organizations, for golf leagues, etc.? And there's a mental health toolkit, also free of charge, and here's the website. You will get the slides, of course, and you just click the link, or you can Google IOC Mental Health Toolkit in Elite Athletes. And this toolkit is meant for physicians and sport organizations. So the website was athlete coach. This is for physicians and for sport organizations on what we can do. The introduction to the toolkit, what is it, how to use it. Then just some definitions to make sure everyone understands what we're talking about, some of the underpinning science so people are brought up to speed. The third section reviews what is our role and responsibility. What should the entourage, the organization, and we should be doing as health professionals. And finally, some very helpful resources and references. So this is a really helpful toolkit. The feedback has been quite positive. So please use the resource that's available to you. So what should our entourage be doing? Well, we should be prioritizing our athletes' mental health as well as their physical health. We can screen them for mental health disorders. We can ensure that they have access to qualified care. And we can provide a safe space, a safe cultural environment for them to talk about it. We in the room have a role in educating others in our entourage on how to work with athletes with mental health problems. And I have to get my caveat of interest in here is implement safeguarding strategies in our sport culture, because we know that athletes who have been harassed or abused are far more likely to have mental health symptoms and problems. So with safeguarding in place, we will prevent many mental health problems. And then support their post-career transition. You know, we've got the whole team around the athlete while they're competing, and all of a sudden they finish, and it's like, bye. and they have no support on how to transition out of sport. So that's a really key time where we see a lot of mental health problems in athletes. So I'm now going to talk about the SMIRT and the SMAT, which are not little cartoon characters. This is a tool that you can use with athletes. Now the SMIRT is the Sport Mental Health Recognition Tool, and this is for athletes, coaches, family members, and any non-physician members of the athlete entourage. How to recognize athletes in trouble with their mental health. The first thing is it lists experiences that the athlete may be experiencing: thoughts, feelings, actions, physical changes, loss in weight, bruising, injuries. And then red flags: self-harm, harm to others. Very key red flags. And then finally at the bottom, what to do. As a non-physician, what do you do? What do you say? So a very helpful tool for the non-physicians in the entourage. Please ensure that everyone in your organization knows about the SMIRT. You can Google it, IOC, SMRHT, HRT, and you can use it. Now for the physicians, there's the Sport Mental Health Assessment Tool. And this is to screen. It's a screening tool to identify athletes in trouble. There is a physician guide and 3 athlete components to this tool. And I'll just briefly walk you through it. Step 1 is a triage. All athletes complete. It's a screen for psychological stress. Step 2, for those athletes that are identified at higher risk, do a more extensive screen. Step 3, intervening or more screening. So 3 simple steps. So let's walk you through it. Step 1 is the triage. The information goes on to the clinician's form. You can put it over on page 2, and if they are below the threshold, the athlete's great, off they go. If the athlete's score is above the threshold, then you go on to step 2. Step 2 is the athlete fills out more questions on anxiety, depression, eating disorders, alcohol, drug misuse, sleep disturbance. And so those scores get put onto the physician's form, and then we've color-coded it so that it's simple. If the athlete is in the green area with their scores, they require brief intervention and support and ongoing monitoring. If the athlete scores in the orange section, those are the ones that have more severe health problems that require more intervention. The caveat is those who score in that red box, and that's suicidal ideation, someone who is at risk of self-harm. That's a red flag, as I mentioned earlier. So again, step 3, if it's in the green, brief support and intervention and monitoring. And if they are in the orange category with their scores, then you do more. They might be more severe, more complex, uncertain diagnosis, or not responding to treatment. Those, frankly and personally, I refer them on to sports psychiatry. But there is additional screening in the tool you can do, and in fact, interventions from the IOC consensus statement. I'm fortunate to have a sports psychiatrist on my team. Those in the orange automatically get a referral to her. So what is our role as sport medicine in athlete mental health? So the athlete support team recognize the symptoms from the SMIRT, Sport Mental Health Recognition Tool. Inquire about their mental health and mental stress when you're treating injuries. If you're a therapist, physiotherapist, or a chiropractor, when you're treating them, how are you coping with this injury? How are you doing? Are you sleeping okay? How are things going? Just open-ended questions like that tells the athlete that you care about them as a human being and it's safe to talk about the injury. And then have a pathway that if you tell them a problem, if they tell you a problem, you know how to refer them on for more care. Sport medicine, screen your population. It's quite simple. The SMIRT is online. I've done it with my university athletes, 700 athletes per year, and I do them a couple of times a year. Make sure as a physician you have the competency to manage common mental health problems. If you ask about them and you find them, you now have to support them. It's more damaging if you identify a problem and then say, oh, thanks for telling me, and then you don't do anything about it. So if you find it, you must actually do something about it. And then know how to handle emergencies and know when to support them to move on. And there is a triage level, the minor problems you can deal with, and then as you move on to more specialized care for the more severely ill. Make sure you have your emergency action plan, as you do for anyone who has a cardiac arrest or anyone who has a serious health problem, that you have an emergency mental health action plan. This is straight out of the toolkit. I won't walk you through it today, but if you download the toolkit, you will see the emergency action plan. And finally, if you want more resources, there is a diploma program online available to you. And it is through this website, sportsoracle.com, and if you get to that landing page, you can click on the mental health program. And this program has all of these topics in it. It's quite an extensive and exhaustive program, but one that you can easily do from home online. And there's a 6-month diploma program, and then there's a shorter 3-month certificate program. The diploma program is more focused towards physicians and psychiatrists, and the certificate program more towards support personnel. It's a wonderful way to gain some experience and knowledge on what to do, and it does equip you with some skills, so it's a lovely program. And finally, to thank the working group that have pulled together the materials that I'm presenting today from around the world. You may recognize Alan Curry, original from Glasgow, a sports psychiatrist now working in Newcastle with UK Sport. So thank you to these individuals. And thank you, every one of you, for taking care of your athlete, player, mental health. So we have about 8 minutes for some Q&A, and if you could introduce yourself and wait till you have the microphone. So open for both Graham or myself for any questions you may have. Unless everybody's hot and needs nutrition and mental health break. We have a question at the back here.
Thanks so much for that lovely presentation about mental health. Really, all sport needs this, and mental health has been such a stigma for athletes, particularly team athletes, who may be getting selected. Now, that doesn't necessarily always happen to golfers, but if they are in a selection process, they will not want to help self-confess this issue. And how have you dealt with that problem?
That's probably when they need it the most, is when they're dealing with those pressures of selection. So I think if you offer them a safe space to go where it's confidential, because you are not involved in selection. So if you are independent at arm's length of any selection process and maintain confidentiality, you in fact can provide them with the mental health when they need it most. And I think it's really important to, because of the stigma, to ensure that your confidentiality. I don't talk to the coach. I don't talk to the selection people. You can share with me, and what stays here, what happens in Vegas stays in Vegas. No, don't use that one. But I think that confidentiality thing is really key because of the stigma and the concern that if I speak about it, it'll go to the selection people and I won't get there. That's huge. Thanks for your observation. It's very important.
Wade Aubrey, UCSF in California. A question for both of you. What, in terms of evidence development, what would you say is a major study that needs to be done on, that is golf specific, on nutrition and on mental health, or mental health and well-being in terms of the benefits of golf?
Okay, great question, Wade. What should we be doing? And to the researchers in the crowd here, we're going to give you a little tidbit. I think one of the key things can actually be wrapped up into one study, and that is prospective surveillance of golfers. And there's some work being done on that, on injury, but we can include in that illnesses, mental health, and include in that nutritional components that could be followed over time. That's one that could combine the two. Now there's others, but that's one big project.
Yeah, I think from nutrition we need to separate the elite from the recreational with studies. So at the elite level, I still think we need to understand the game more. We need to, say, probably do that doubly labelled water study just to make sure that we are fully understanding the demands and we can fuel it better. from the recreational level when it comes to nutrition, for me, it's that, are we getting the balance right between people going to a golf course for health, but then fueling it properly and actually maybe negating some of the benefits by inappropriate fueling? And what we do see a lot of correlative evidence about how good golf is for health, and I just wonder, does that also differentiate them who get the fueling right? And if we did get the fueling wrong, could we actually then not get any health improvements? So for me, there's two key questions, one in the elite game and one in the amateur, that we still don't know the answer to.
I think we have time for one final question.
Andrew Cullen, PGA golf coach. For the nutrition side of it, how do we change the mindset of the recreative golfer to actually fuel himself better rather than the Mars bars and Coke, which is traditional?
Yeah, so I know there's behavioural scientists in the room this week, and it's the way nutrition's going now around the behaviour. And, we talk a lot in elite sport of, as I said before, the COMB model, COMB, capability, opportunity, motivation. And if we get them three right, we can get behaviour. So capability, does a recreational golfer know? Have they got the knowledge? Can we educate them better? Can we put information out there? Can we let them know what the tour players are doing? Just simple things like showing what the tour players take onto a round of golf with them. People like to copy, don't they? There's a reason why everybody wants the latest driver, because the tour players are doing it. So I think we can get better at telling people what the tour players are doing. So that would help with capability. Opportunity, well then we need to get the right things in the golf shops. How often do you see a golf shop selling a banana? But that's the one thing we put on the tee at every golf event. Can we start to influence the opportunities that are available? And then the motivation, then the education has got to be out there around not only health but performance. We know that when it comes to health, a lot of people have that "it won't happen to me" mentality. But when it comes to performance, we have that "it will happen to me." We always go thinking that we're going to get a hole-in-one or we're going to have a PB. Well, actually, the motivation may come from, if you fuel like this and if you eat like this, this is how Tiger, this is how Rory eats. So I think we need to ask ourselves, which of them three is the key driver: capability, opportunity, or motivation? And then let's go and attack them all.
Excellent. Thank you very much. I think in the interest of keeping on time, we will break now for the coffee break. Thank you for your interest.